Drinking on Zepbound or Wegovy is not automatically dangerous, but it is not automatically fine either. The main risk is not a hidden chemical clash. Alcohol can amplify nausea, dehydration, and bad judgment at the same time. That is why one social drink can turn into a rough night faster than people expect. Most people start with the wrong question. They ask whether alcohol is forbidden on these drugs. The better question is, what alcohol adds to a body that these medications can make more sensitive to both dehydration and stomach upset? That shift matters because the answer is usually about context, not a dramatic interaction. Some people tolerate a small amount and feel mostly normal. Others feel awful after what would usually seem modest. The difference often comes down to setup. One person started the night steady, while the other started with less food, less fluid, and less margin for error. I'm Dr. Kim, a licensed physician. This is not medical advice. Consult your doctor. Alcohol is usually not the forbidden substance here. It is often the side effect multiplier. If your stomach is calm, your meals are regular, and your fluids are good, risk may be lower. If those pieces are already weak, the same drink can land very differently. That explains one common confusion. One person says wine was fine, and another says 2 drinks ruined the weekend. Both stories can be true. The first person ate, drank slowly, and showed up well hydrated. The second may have started nauseated, underfed, and already close to the edge. There is another piece people miss. These drugs can reduce appetite enough that some people eat much less than they realize. Then alcohol arrives on a smaller fuel tank. It feels stronger, recovery is worse, and symptoms that were mild can suddenly become the center of the night. So what should you judge first? Not the bottle. Judge the body. If you already have nausea, reflux, burping, dizziness, loose stool, or poor intake, that is not a neutral setup. That is your body telling you the margin for error is smaller than usual. Risk also tends to be higher during dose increases. That is when stomach side effects are often more noticeable. Testing alcohol tolerance during the least stable phase is bad timing. It is like checking roof strength in the middle of a storm. That timing problem runs deeper than most people realize. The mistake shows up later, not in the moment. They judge based on how the drink felt at the time, and that is often the wrong checkpoint. The more important question is, what happens after sleep, after fluid loss, and after the stomach has had more time to react? And that delayed reaction is exactly why the setting matters so much. People usually do not drink in calm, controlled conditions. They drink at restaurants, parties, trips, celebrations, and weekends away. That means bigger meals, saltier food, later nights, less water, and worse judgment. The setting often creates the problem as much as the alcohol itself. Drink type matters too. Fizzy drinks can worsen bloating and reflux. Sweet cocktails can hide how much alcohol you are really getting. Strong drinks on an emptier stomach can go badly fast. That is especially true when symptoms were already brewing before the first sip. Food matters in both directions. Drinking without food can make symptoms hit harder, but a huge greasy meal is not a clever fix. These drugs already slow stomach emptying, which means food leaves the stomach more slowly. Add alcohol and a heavy meal, and nausea or reflux can get ugly fast. Beyond the stomach, there are other systems alcohol can pressure at the same time. Blood sugar is one angle people often miss. Alcohol can push blood sugar down, especially when food intake is poor. If you have barely eaten because appetite is low, weakness, shaking, and lightheadedness may show up sooner. Then people blame only the medication, even though the setup was doing half the damage already. There is also the pancreas question. These drugs carry a warning about pancreatitis, which means inflammation of the pancreas. Heavier alcohol use can also stress the pancreas. One small drink does not automatically trigger pancreatitis, but stacking another known stressor on top of that warning is not a smart gamble. Gallbladder problems belong in the same conversation. Fast weight loss can increase gallstone risk, and these drugs also carry a warning about gallbladder disease. Alcohol does not make that setup safer. If you have upper belly pain after meals, with vomiting or back pain, that is not a good day to experiment. Kidneys belong here too, although the path is indirect. Alcohol can increase fluid loss, and vomiting or diarrhea can do the same. If enough fluid is lost, kidney stress becomes more likely. Then a person may feel as if alcohol was the whole story, when dehydration was doing much of the damage. The internet story about someone else being fine does not decide your risk. What matters is your symptom load, food intake, hydration, and stability on the dose. A calm week on a stable dose is very different from a rough week with nausea, reflux, and poor intake. By this point, the decision rule should be clearer. If symptoms are active, appetite is poor, or fluids are low, drinking is usually a bad trade. If symptoms are quiet, meals are regular, and water intake is good, a modest amount may be tolerated better. Lower risk does not mean zero risk. What does modest mean in real life? It means avoiding the casual slide from one drink to several. It means drinking slowly, eating first, and drinking water before and during. It also means not treating appetite suppression like a party trick. A body running on too little food has less room to absorb mistakes. There is one more misunderstanding that catches people off guard. A person may drink once, feel fine, and declare the issue solved. That is weak evidence. Tolerance changes with dose stage, meal timing, sleep, heat, activity, and current side effects. One good night does not prove the next setup will behave the same way. That unpredictability also means knowing when to stop waiting. Some symptoms are not a wait-and-see situation. Repeated vomiting, severe belly pain, black stool, fainting, confusion, chest pain, trouble breathing, or inability to keep fluids down all need medical attention. If severe pain reaches through to the back, pancreas inflammation belongs on the concern list. Do not wait for those to pass on their own. So, can you drink on Zepbound or Wegovy? Sometimes, yes. But that is not the safest frame. Alcohol is often not the direct enemy. On these drugs, context is the interaction. If symptoms are quiet and meals are steady, risk may be lower. If those pieces are not in place, alcohol can magnify a weak setup quickly. Judge the drink by the condition of the body holding it. That is the part most people learn too late. And if drinking is becoming a regular habit during weight loss, that pattern alone is worth a conversation with your doctor. Medicine simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.